We're back here with Dr. Fong, dentist from San Jose. Hi, Dr. Fong.
Hello, Helmut.
Dr. Fong, let's talk a little bit about periodontal disease. And when it comes to periodontal disease, there's a couple of things which I really want to understand. When a dentist sees that a person has periodontal disease, he very much keeps telling us that we got to fix it because otherwise down the road, 2 years, 5, 10 years later, whatever it might be, we will be losing our teeth. Now, that's very bad. No doubt about it, because it costs a fortune to replace it. But that's the point. You dentists are very, very good at replacing the teeth with implants and all that stuff. And in the end, I mean, we say that some movie stars don't have their own teeth in the first place because, they want to have that Hollywood look, which they naturally didn't have. So, however, you're losing the teeth because you have an infection in the mouth, that yellow, reddish, ugly pus, which is in the mouth, all over the mouth, and it drips into the blood because the mouth is the gateway of the blood vessels. It's the gateway to the blood vessels, and you're ruining the liver, you're ruining the kidney, the heart problems, brain damage, strokes, immune system is lowered, women get premature babies and by doing so have underweight babies. So the list is long with problems which occur right there and then, and in my opinion are very difficult to fix, more difficult to fix than putting an implant in it, a tooth implant. Tell me, how correct is my talk here? Is it really true that the body gets poisoned with this thing, that all these things could happen, or is that not really actually going on and the loss of tooth is the most important bad thing?
Yes, Helmut, your observations are absolutely correct. The medical conditions that an individual has is directly interrelated and correlated with periodontal disease or disease in the mouth. The body and the mouth are interrelated. They're not separate from one another. So, therefore, what happens in the mouth, it is a gateway. It is a window to the remaining health of the rest of the body. So, yes, periodontal disease is directly correlated to medical conditions. Let me give you an example. For instance, like with diabetes. When they have diabetes, their immune system has already been compromised. As a result of that, that can lead to an easier way for bacteria to cause and lead to periodontal disease in the mouth. So, yes, it is very important that an individual go in and see their dentist on a regular basis to have periodontal disease checked for, because for many people it's not painful, but as they get older and the destruction and deterioration has already occurred on the gums and the bone and the supporting structures, then they begin to lose their teeth. But then medical health-wise, they have already been deteriorating as well. But if we can try to help to improve their gum health, then that will lead to hopefully a stronger immune system, which will help with their medical conditions and to help them to remain healthy and stable.
Right. I've read an article that in a Japanese university they found out and traced back that people who have HIV are much more likely to transfer into full-blown AIDS, because you can have HIV for a lifetime and never get AIDS. It never basically bursts out. If people have gum disease, simply because, as you said, the immune system is so much lowered. And in fact, over the last years, there are many, many surgeons, people who do hip replacement, knee replacement, or just, appendix operations or tonsils and all those type of operations. And they start demanding more and more over the last few years a clean oral health, a clean bill of oral health. And mainly, they're interested in gum disease. They're not so much interested in a cavity here and there. They're not at all interested in crooked teeth and all that type of stuff. They're just interested there's an infection in the mouth, and that infection could go to the wound, the cutting he's doing, and infect that wound, or generally make the body so weak that the extra addition of a surgery, which weakens the body in any case, just isn't to be done. Like no surgeon at any time, as long as I remember, would operate you on appendix or on a hip replacement if you have, let's just say, a full-blown lung infection going on at the moment. They would get that cured first, and they start realizing that a full-blown lung infection and a periodontal disease are pretty much the same thing. They both weaken the body. They both risk the infection, the wound where you then do the cutting, whether it's a hip or appendix, to basically get inflamed and infected and not cure. Is that, have you noticed that in your practice, that people coming in and saying, I need a clean bill of health for my surgeon, otherwise he won't do this or that on me?
I think as health professionals, both medical and dental, we've always known that the body is interrelated. It's now that the public is becoming more educated and they're beginning to understand that, yes, the mouth is a part of the body. It's connected. So health-wise, if everything is healthy, then it's going to ensure the success of any health professional, whether it be your physician, surgeon, dentist. We're all trying to help you to attain the best possible health and to ensure the success rate of whatever we're trying to do to help correct those medical conditions.
Yeah. So obviously you want to keep your the rest of your organs, the important organs in your body, healthy. You want to not be wiped out by every little flu season which comes around, and by doing so miss work and be weak and fatigue and tired. Keeping your mouth healthy is important. Is it true that that in the mouth the infection is as big as more or less your hand? If you have a nice full-blown gum disease, you have an infected area which is almost as big as your hand. Is that true?
Well, I think the mouth is much smaller than the hand in some ways, and so therefore the infection may be small, but it has the potential to spread. And so as a result of that spreading, it can get to other areas of the body. And so therefore, the magnitude is much greater.
Okay, all right. Yeah, because, if we have a little infection on our skin, which is big like a little penny or so, and it doesn't go away, we go to a dermatologist or something very fast, as we should. But then we have this huge infection in the mouth all over the place, much, much bigger than a penny or something, and we don't go. And on top of it, it's so close to the blood vessels. Anyway, thanks for, definitely straightening this out or confirming that, yes, if you have infections in the mouth, it just ruins the rest of the body and takes away life from you in terms of, because when those other organs are ill, it couldn't be good. Dr. Fong, thank you very much to inform us about the gum disease. So good.
My pleasure, Alan.